My name is Jan Hahn, and I am in the School of Interdisciplinary Health Programs as an assistant professor. I also am the coordinator for the Center for Gerontology here, which is a university-wide center. And I am interested primarily in improving the quality of life for individuals with dementia. So my research interests have focused on that, quality of life for individuals with dementia. I became interested in studying dementia as an undergraduate student, and I had already had an interest in the lives of older individuals, and primarily because of my grandmother. I think I had a good affinity with her and other older individuals. And then she did develop dementia, probably of the Alzheimer's type, though it wasn't diagnosed that accurately. And so throughout my undergraduate research projects in my graduate school as getting my Ph.D. in sociology, I focused on how families surround people with cognitive impairment, dementia, and how the healthcare system and long-term care system supports individuals with dementia. Dementia is an umbrella term for different types of cognitive impairment. The primary one is Alzheimer's disease, and the second most common one is vascular dementia. And then we have some other types such as Lewy body disease, Pick's disease, Creutzfeldt-Jakob, and some others. And then there's the very less common but very disturbing early onset dementia, or early onset Alzheimer's disease. All of these things have changed in how they're named over the years, but in general it's a progressive cognitive impairment primarily occurring in later life. Well, what I've learned in my years of studying the lives of people with dementia is that we can make a difference. We can absolutely make a difference. People with advanced dementia do not need to be in a nursing home with nothing interesting to do. They have quality of life. They can have a good quality of life if we surround them with activities they enjoy. And I was just talking today, and that's just jumped in my mind, of a woman whose daughter has an early onset type of dementia. And she still likes to go outside and ride a three-wheeled bike. And that's fabulous. Too many people get the idea that you get this diagnosis and then your life is over. So my research has all focused on ways to improve lives through activities, through making the nursing home a better place, through culture change. And now my current research project is on how do we do interventions one-on-one with someone who with advanced dementia, moderate to advanced, in a skilled nursing facility. Types of interventions that can make a difference in a person's life include simple activities. I've done a study at a local continuum of care retirement facility about using enhanced fitness, which is an evidence-based fitness program with individuals in assisted living with some level of cognitive impairment, and we showed that they had direct health benefits from doing this. We've done evaluation of a cardio drumming program, again for individuals with dementia, and we were able to show that they were engaged during the activity and after the activity. So these ways of engaging people can really make a difference. The current project it's a 3-year project that I'm focused on, I'm doing with Dr. John Baker from the Department of Psychology, and they are using behavior analysis to focus on individuals with more challenging behaviors. Maybe they wander, they yell, or they hit, or they spit, a variety of things that might not go over so well with the staff of a skilled nursing facility or with families. And so we were able to get some funds from the state of Michigan, from the fines that nursing homes pay to the state, and they're funding research to improve care, which I think is an excellent way to use that money. And primarily Dr. Baker and his graduate students, who are trained in behavior analysis, will spend a lot of time with these individuals and the staff who work with these individuals and find ways to modify their environment so that they're less likely to have negative behaviors. So not only will improve the quality of life of the person with cognitive impairment, but improves the life for the families and the staff who surround that person. And it's just taking some time and realizing that these people can learn and they can react and they have emotions. And if we are more sensitive to all that, we can make the environment better for them and improve their quality of life. A lot of people are concerned about whether or not they will get dementia. And we don't have a lot of ways of predicting that, though actually there are some genetic markers, and if we spend a lot of time and money, we maybe could get an idea that you might develop it over time. But there are ways to not totally prevent it, but there are ways to slow down the symptoms so they may not affect your life. You might end up dying of something else, because of course we all die. A lot of people don't want to even embrace that. The easiest message is what's good for your heart is good for your brain. So research has shown over and over that eating right, exercising are great for slowing down any potential onset of Alzheimer's disease or another type of dementia. They've also shown that using your brain in different ways does make a difference. So it's not just doing crossword puzzles, but developing some other paths of keeping your brain strong. And even social support, that's some of the newer research that shows staying engaged socially is really good for you. And again, that can push off those negative symptoms. For some people, there are certainly college professors who have been running marathons and eating right for years who will still get Alzheimer's disease. But we can push off the symptoms. That's some of the good news. I think collaboration is very important in research, and especially as a gerontologist. While my primary discipline is sociology, I also consider myself a gerontologist. And we come to the study of aging with a focus on late life from many different disciplines. We have psychologists, biologists, and then more practical disciplines such as social work, medicine. The area of medicine that focuses on gerontology is called geriatrics. We need many more geriatricians and many more health providers. But there are also people like me and Dr. Baker who aren't providing specific health care, but we are doing research and trying to find out how to improve the lives of others. So in the current research project that Dr. Baker and I are working on, we're looking at different things. I am more familiar with organizational change and approaches to quality. He is an expert in the actual techniques of behavior analysis. So I am looking at what it takes in a skilled nursing facility to implement changes. So when Dr. Baker and his team works together and comes up with this great plan, here's what your staff should do, this is a training module, this is how they should be trained. What does that go and sit on a shelf? Do they say, oh, the researchers are gone, this is over? What does it take to make that change actually happen? So that's one of the great things about working together across disciplines. But in my opinion, any teamwork is going to enhance what you do in research, and especially in gerontology, where late life is life, and it's pretty complicated. So it's really important to work with others who can enhance your thinking process while you're trying to answer questions. One of the reasons I'm interested in studying dementia and the quality of life for individuals with dementia is there are people in my family who have had it. My grandmother had some type of dementia. An uncle had it and an aunt, both on my father's side. So I like to share a photo of my family and with my grandmother sitting in the middle in a wheelchair. At that time she had pretty advanced dementia. And also, she was at a time when they actually used physical restraints. It just shows the times have changed. She was given medications to kind of calm her behaviors, which is no longer the right thing to do in skilled nursing facilities. She was put a belt around her waist so she wouldn't wander. That also is not the right thing to do. So that's one of the things that has changed already. You know, I've lost track of how many years ago, 30 years ago at least, our care processes have changed. So, and then later in life, of her 5 children who survived to adulthood, 2 ended up getting some type of dementia. My uncle had Alzheimer's, no, he had primarily vascular dementia, and my aunt had more of an Alzheimer's type dementia, and I have them color-coded in a slide, and along with the age where they died. And a couple of them died at a pretty late age, in their 90s, and they still did not have any type of dementia. So it's hard to predict. I think my family is not atypical. You know, once you reach age 85, about 1 in 3 will have some type of dementia. So there's not a really strong family influence related to getting dementia, but it's there, and I know our lives are all touched by it. So that's why I like to share a picture of my family, because certainly my life has been touched by it. I would like to continue to do research regarding how staff in nursing homes, or skilled nursing facilities is the technical name, how they can change their behavior to enhance the life of those who are living there with some sort of cognitive impairment. And at least half of those in a skilled nursing facility do have some level of cognitive impairment. Another area of interest that I've submitted a couple times and hasn't quite happened for funding is there's a real disparity in getting to a diagnosis of dementia. And especially in African American individuals, there is a slower, they're later to get to the diagnosis. And I'm trying to figure out why that is. Because there are some benefits to getting to a diagnosis in a timely manner. So then your family can get things into place, you can better express your wishes. There are some medications that can slow down the symptoms, but in general, our healthcare system isn't great at getting a diagnosis for anyone, and it's really even worse for individuals from African American backgrounds and also Latino backgrounds, where they just don't get to the medical care or the medical diagnosis in a timely fashion. And that's something that has bothered me for, I think, 20 years now, and I still think we need to find the answers to try to get that to improve.